All around me are familiar faces, worn out places, worn out faces, bright and early for their daily races, going nowhere, going nowhere. Their tears are filling up their glasses, no expression, no expression. Hide my head, I wanna drown my sorrow. No tomorrow, no tomorrow. And I find it kinda funny, I find it kinda sad. The dreams in which I'm dying are the best I've ever had. I find it hard to tell you, I find it hard to take. When people run in circles, it's a very, very mad world. Mad world. Children waiting for the day they feel good. Happy birthday, happy birthday. And to feel the way that every child should sit and listen, sit and listen. Went to school and I was very nervous. No one knew me, no one knew me. Hello teacher, tell me what's my lesson. Look right through me, look right through me. And I find it kinda funny, I find it kinda sad. The dreams in which I'm dying are the best I've ever had. I find it hard to tell you, I find it hard to take. When people run in circles, it's a very, very mad world. Mad world. Enlarging your world. Mad world.
How would you describe CRPS?
The CRPS is basically it's characterized, it's said to, the name is complex regional, thank you. I know what it is, I just can't get it out, I'm having word finding problems. Complex regional pain syndrome. And, you know, what that is basically is a cyclical kind of effect that goes on in your body where it doesn't necessarily, the pain doesn't get processed. It was originally found in Civil War, and that's where they actually noted the symptoms and what was going on. You know, CRPS is very difficult in the individuals because with CRPS you can blow on somebody's hand and it can hurt like on a scale of 0 to 10, it could be a 10. And they have to go get treatment of some type. One of the problems is that it sort of goes. Let's say I have it in the wrist. I have complex regional pain syndrome in the wrist. What happens is the impulses go up, but they don't go all the way up into the thalamus to be processed, where you can have endorphins released to help with the pain and things like that. What ends up happening is it becomes cyclical. It doesn't get up there and it comes back down. And that's what happens, you know, and it's one of the more difficult diagnoses to treat because of that, because you know you have to stop the pattern somehow, but the pattern doesn't stop because it's continuously cyclical. Do you need me to go into more?
That's fine.
Are you sure?
Yeah. Okay. How have you seen CRPS affect patients' daily lives?
Okay, as far as that goes, it can cause them to not participate in any of their daily life because the pain is it's so painful. Like I said, if you blow on somebody, they're going to scream. Think about if you just move it in the air, just like this, they're going to scream. And most of the time, you're not going to have movement. There's 3 stages associated with the CRPS. The first one is trophic changes in pain. Discoloration, some swelling, and edema. The second one you get better and you have some movement, but every time you move in the first stage, you actually have an increase in pain also. And then the second stage you get a little better and you have some movement, but then in the third stage you basically have demineralization of the bones in your fingers. I don't have anything on my desk, but they basically just bend. There is no rigidity to it, and you end up having a non-utile hand at that point.
How would you say that you treat CRPS? What have you used?
Any way that's successful, quite honestly. And we'll talk about this in future classes. CRPS is difficult in the sense that you don't know what people are going to respond to. There's a variety of different ways you can go. One of the things that I found in my experiences is that high volt or galvanic stim, electrical stim, has been very beneficial. And if you do it in water, it can encompass the whole extremity and create a block so that the pain doesn't necessarily go there. You can get some more. It's sort of like a TENS unit, but what ends up happening is you can get more movement that way. Also, the fact that the gravity's gone in the water helps assist. There's scrub carry, where you're actually scrubbing on a table, you're weight bearing, so that you get that feedback, and then you go and carry a heavy weight, so you get a stretch as you go. And I'm talking about mostly in the upper extremity. You can have CRPS anywhere in the body. I mean, if you go online, you can find it for any place.
Is it more prevalent in the upper extremities?
In my practice, that's what I've seen. I have seen some ankles with CRPS, but I haven't seen much else as far as lower extremity and things like that. Most of the people that I've seen have been falling on their outstretched arm. It's a distal radial fracture, and you have to be very, very cognizant of CRPS during that specific diagnosis. And it was mostly elderly ladies that fell on the ice in the north, or have had really significant Colles fractures that are associated with it. But you can have CRPS anywhere.
What behaviors would you say are associated with CRPS in the patients?
One thing is that they choose not to participate because of the pain. The other thing is, I think, which you brought up earlier about the anger, I think is more frustration and also an inability to have the pain controlled. So what ends up happening is people tend to lash out or not. That's their way of dealing with it because they're in so much pain. You'll see a lot, going back to some of the behaviors that you have a lot of posturing where you won't move your arm because if you move your arm, it hurts. I mean, it's like I was saying, if you blow on it, it hurts. Well, if you move it, it hurts. The things that we want to do throughout treatment is we want to get general range of motion back, and then we want to work on strengthening. But, in the first stage, you're going to have a difficulty with range of motion because what ends up happening is when they move, it hurts. And so basically they avoid moving. It's like when you say, "Hey, doc, it hurts when I do this," and they go, "Don't do that." That's exactly what happens with CRPS people. Because it hurts so much, they're going to stop doing that. So, again, going back to the treatment is difficult because you don't know what's going to work with somebody. You could do general range of motion, you could do E-stim, you could do heat modalities, you could do cold modalities, although I don't know that cold modalities are really going to affect them that much because of the pain issue. And anytime you touch them, they'll go through the roof. So, so it's a matter of what works. And basically you have to look in your bag of tricks and try everything.